Welcome back to my channel. In this video, we'll discuss about the histological changes that occur on the pressure and tension side on the application of the mild force as well as on the application of the excessive force. So first of all, we'll draw a diagram like this, and then we will illustrate. First of all, the thing that you must remember is the direction of the tooth of the movement. Tooth movement is towards the pressure side, towards the orthodontic force. Okay. Now coming on to the pressure side and tension side, PR. Okay, so remember that resorption is going to take place at the pressure side, PR. Okay, and TED, tension deposition. All right. Now, first of all, in the pressure side, what we will see is there will be compression of the PDL around 1/3 of the total length of the PDL. There will be increase in vascularity, fibroblast, and the osteoclast because a resorption is going to take place. They will mobilize into the house shaped lacunae. Then there will be this is important point, there will be change in orientation of the bony trabeculae, which were first parallel to the long axis. Now they are horizontally inclined parallel to the direction of the orthodontic force. Alright, now very important, in the detention phase they revert back to their original position. This is also a common cause why relapse occur. So in this we will see that there is frontal resorption. The frontal resorption, it means that the resorption is taking place adjacent to the marrow spaces. Okay, now in tension what you will see is over here you will see compression, over here you will see it is stretched, vascularity both increase. Okay, so in fibroblast over here, because I told you deposition will occur, so osteoblast will mobilize. Then since it is deposition is occurring, so osteoid adjacent to the lamina dura, lightly calcified bone, then it converts into woven and mature bone. Then coming on to this was mild force. Now if we apply excessive force, similar diagram. Okay, in pressure side, in this initially you were seeing 1/3 of the total length of the PDL being compressed, but here you will see total. Then roots will closely approximate to the lamina dura. Then occlusion of the blood vessels, hyalinization. It is a regressive change. Now what is hyalinization? It is the formation of a degeneration or a degenerated tissue of clear eosinophilic zone. It is basically characterized by the compression of the collagen fibers, the loss of cellular structure, pycnotic nuclei will be seen. All right, there will be no fibers present. All right. Also, hyalinization state occurs usually during the lag phase. So in this lag phase, as we all know, there occurs no tooth movement during the lag phase. Also, hyalinization can be eliminated by two methods. One is by the resorption by the osteoclast, and second is by the clearance of the necrotic area by the cells derived from macrophages by phagocytosis. All right, now over here bone resorption, because pressure side R. Okay, so it was adjacent to the marrow spaces. In the previous one in mild force, you saw that it was near the marrow spaces, so it was frontal resorption. But this is adjacent to the marrow spaces of alveolar plates, below, behind, and above the hyalinized area. Okay, remember all these by BBA. So undermining resorption, there we had frontal resorption. Then tension side, since it is excessive force, so overstretching can occur, tearing of the blood vessels, ischemia, and increase in the osteoclastic activity. One more thing you can remember is pain and hyperemia in gingiva. All right, now thanks for watching this video. Next video I'll be talking about the various phases of tooth movement.